Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, everybody wants a beautiful smile. Sometimes we have a person who covers their mouth all the time, and they don't want to talk, they don't want to smile, and you wonder, well, they're just, they're shy. They're not shy. And I think that we'll hear why from Dr. Alexis Morales, who's a prosthodontist. It's more than a dentist, and we'll explain that later. And he is with Florida Dental Rejuvenation. So thank you, and welcome to the show, Dr. Morales.
Thank you so much.
You know, when I just said, don't you notice people and they talk to you with their hand over their mouth? And isn't that usually because they're ashamed of their teeth?
That is correct. Unfortunately, smile is our first presentation to the world. And some people out there, they don't feel comfortable. And yes, they cover, or they even have to don't go to events.
Yeah, exactly.
I just recently had a patient, and we did a full smile makeover. And she told me for the past 10 years, I've been hiding from any social activities because I wasn't feel confident going to. But now that she has the work, it's like a brand new world.
Can you imagine someone going for a job and trying to speak with someone and they don't have great teeth, and that potential employer, all he can or she can look at are those teeth, and it will make a difference, I think. And if they're hired, sounds crazy, but don't you?
No, actually, I had an experience also with another patient. Patient has a master, has PhD in business too, and he was trying to look for a job in his career. He couldn't. He was working as a server for a while, like around almost 3 years, because nobody hired him. And the problem is, for the area he was come from, his diet destroyed his teeth. So you can't even see nothing. They were just pieces of roots. And he was ashamed of it. Until he decided to do the treatment. We did the treatment, and 1 week after, he got hired for his job. So,
that's a wonderful story. So let's say a person like this comes in to your office. How quickly, if you do it right, somebody, just like you said, would they be able to feel like there's a possibility? Maybe it's not perfect yet, but how long is that going to take?
Oh, every case is different. We have the capability to do the smile in 1 day with the implants and hybrids, or we can also do the treatment to 6 months. Sometimes it can take to a year. The first thing I want to get from the patient is I want the patient to be comfortable. I want to teach the patient what we're going to do. I want the patient to be involved in everything we do. And I think that's going to set a difference. I don't want them to just put them on the chair and throw treatment and get out of here. It is important for the patient to understand what we're doing, because it's not just about smiling and look pretty. We want function. We want something that's going to last you longer. And unfortunately, I've been seeing most of the cases, they don't last that long that they used to be before. And it's because of bad planning or sometimes for rushing. So that's important for us. First, the communication with the patient.
In other words, you're going to spend time with the patient. And nowadays, whether you're a dentist or you're a doctor or in the medical field, time is very important, and a lot of people don't get the time they want.
Unfortunately, that's right. It's a rush service in most of the other places.
So tell me exactly, that's a great name. Tell me exactly what a hybrid denture is.
A hybrid denture, as you know, the name hybrid, you combine two characteristics or two elements. In this case, we combine implants, and we combine prosthesis. So the hybrid part comes, these are prosthesis. I'm going to put it in your mouth, and it's not going to come out from your mouth. You can't take it out. You're going to go ahead and sleep with it. You're going to go and function, eat. Don't worry about putting in adhesives, nothing like that. But when it comes to maintenance, I'm able to remove it. I can remove the prosthesis, clean it up perfectly, and put it back in your mouth. If something happened, you bite into a fork, a piece of the restoration cracked, we can repair it the same way. We can remove it, repair, and put it back in without going to the cost to redo the whole prosthesis again.
So it's like a denture, but it's not, because people take their dentures out every day.
Exactly.
Morning, night. Well,
And-
what happens if they get some? Well, then they won't get food in there because it's a different system, isn't it?
Yeah, there's no food trap. There's no movement, because the difference with the denture is supported just on the tissue, on the gum. So sometimes it irritates. Sometimes it's not as comfortable. I have patients, they ask me like, oh, I have a friend and he can eat anything with dentures. So I ask that patient, okay, you know this friend, but how long ago that patient lost their teeth? If you're in your 30s or 40s and I give you a denture, believe me, you're going to get used to it really quick. But after we reach 55, 60 years old, and I'm going to give you a denture, it's not going to be the same than when you were in your 30s or your 40s. So that's why we have all these opportunities available for you, all these treatments with implants. So it's going to make you function and you're going to be comfortable with them.
I would like to give our listening audience a way that you can get in touch with Dr. Morales so that you'd be able to make an appointment. And you are having a free consultation. Someone can come in and you will examine them and then tell them what you feel you can do for them.
That is
right?
correct. I want them to come to the practice. Make sure this is what they want. Make sure they feel comfortable. They can ask me anything. We can spend time with the patient. We just dialogue, and then I can offer some treatments. And then we decide if we're going to do what we're going to do, what's going to be our next step. And the consultation is free.
Okay. Phone number, everyone. Remember, this is Pencil Talk Radio. So get your pencils out. It's 561-749-9721. Again, that's 561-749-9721. And Dr. Morales' practice is located in Delray Beach on South Federal Highway. It's 3100 South Federal Highway. So it's 561-749-9721. And if you would like to get their website on your computer so you can see more about it, it's called FloridaDentalRejuvenation.com. FloridaDentalRejuvenation.com. Everybody wants to be rejuvenated.
Absolutely.
And their whole body, not just their teeth. So, but it's a good way to start, because actually I have seen people with very good bodies and very bad teeth. What is that? Don't they see when they look in the mirror? What is their? Are they afraid of a dentist? What is this?
There are some...
I'm asking you to be a psychologist.
Yeah. No. but what I see is priorities. You know, some people priorities is different from you, from me, from everybody else. Everybody has their priorities. The way I see the mouth is the first contact pretty much with the outside wall to the inside wall, because that's when you're going to eat. You have to use your teeth to chew. If you don't have teeth, you don't chew properly, you're going to have problems with your diet. You're going to have some gastric problems. Everything goes from there. You can have also some TMJ problems, which is with the mandible, the articulation with the mandible. So everything starts like that. If you don't have a good set of teeth structure, you also can have wrinkles in some areas because the face gets depressed as well. Everything goes from one point to the other because the whole body is connected.
Yes, and you're not going to be healthy, as you said, and it's very bad. And no one wants to kiss, pardon the expression, no one wants to kiss somebody with bad teeth. Sorry, I just had to say that because it's true. When you look at someone, that's just what happens. But, on a serious note, so let's say somebody doesn't want the denture, the hybrid dentures, they want more. Explain what all the other opportunities are.
For the hybrid denture, you can also have the conventional fix on implants, which means it's a bridge supported on implants, but that is something it can't be removed. Not by me, not by the patient. Or the expense is higher than the hybrid denture, but it's also perfect treatment plan to do. Or what we do also is overdentures. What is an overdenture? An overdenture is simple, a regular denture with implants supported. So you place, instead of having the glue and having like a big extension of a denture, you cut part of that denture, and it's gonna be clicks on the implants.
I've heard about that.
So
do you
that's
like
an
that?
overdenture.
Do you like that idea?
The overdenture, of course. What is gonna make you function? That's the most important. Don't let your mouth just let it go and fill with empty spaces.
And there are a lot of people who are listening who probably have had dentures for a long time. And I would say that, not knowing them, but I would assume that their mouth structure has changed. And I would think they ought to come into you so that they can have you examine them and see if you have to change the denture.
Dents are supposed to last tops of 5 years. If the denture is still usable because the teeth, they're acrylic, so they get stained, they get wear off. So sometimes you can just reline the denture again, or sometimes you just need a new denture. But the bone is going to disappear. When you don't have implants, the bone disappears.
Oh, is that right?
Yeah.
So what happens to the bone? I don't know much about that.
Oh, the bone works by stimulation. That's why when we walk, when we move our hands, when we do any kind of exercise, we have stronger bones. If we keep without doing nothing, the bone starts like just getting fragile. Same thing happening in our mouths. As time goes by, if you don't have any kind of prosthesis to stimulate the area, the bone is just going to shrink and disappear. And there's going to be a point, no denture or anything is going to hold. I don't care how much adhesive do you use. So the bone is always have to be active. When we place the implants, we stimulate the bone to stay at that level, and sometimes even to grow a little bit.
That's excellent.
Yeah.
And as far as I know, a lot of this, it ranges in different prices, but there is a way that people can finance this, isn't there?
Absolutely. We offer credit. We offer several type of payments. We have Kathy. She's our office manager. She always works personally with our patients. And she sees the conditions, and we can prolong the treatment, whether it's going to be comfortable for the patient.
Sounds like you really care a lot, and that if they come in, you're going to figure out some way to do something.
Absolutely. They're welcome to come. I want them first. I want my patients to come to the office, make sure they like what they see. I want them to look at the website, see all the cases we have. We update the cases every 2 months. All the cases you're going to see, they're not Photoshop from images from the web. Those are real patients all treated by me.
And would any of your real patients, if they wanted to talk to them, would they be willing to talk to someone?
Absolutely.
Absolutely. That's great.
Absolutely.
Yeah, well, it must be wonderful for you. And I'm sure you take pictures before, during, and after.
That is correct.
Because that's what people then can see. And, I have to just say this. We try to keep this show very light. And I'll just say these things. And I'm not going to embarrass you, but I'm not you. When women have breast implants, the thing they want to do is show everybody their breasts because they're not theirs, truly. I'm sorry. I'm just going to tell you this. I don't know if you're familiar with that, but it happens. And they're so excited about it, whether they've had, whatever have had. Some people, of course, have had cancer and they've had mastectomies. But they're so thrilled. And I'll bet the same thing happens when people have new dentures or dental work. They probably smile all the time to show, there's my teeth, right?
Yeah, the reaction is priceless. But beside that part, what I like also is the function. To see like everything's going to work properly. The patient's going to be able to chew comfortably, to interact with society without worrying about things coming off. And also, another problem is when patients, they don't care and they let gum disease take over. We have articles from the American Dental Association. They relate endocarditis with gum disease.
Uh-huh.
So it's not just about the teeth. Because every time you're going to swallow that bacteria, it's going to pay somewhere. Because, again, the mouth is connected to the body. It's one thing for another. One of the problems most of us we face as a dentist is it's a silent enemy. So patients, they don't go because there's pain. The bone starts like going away. You don't feel any pain. Everything keep functioning. It's like you have like when you have a tumor, it could be malign or benign. It's the same thing. So it's something slow, just eating and eating and eating, and you don't notice. I would say for any caries or any mouth disease that hurts, maybe it's 10%. Because the body always tries to adapt. Sometimes the nerve gets exposed and the nerve dies, so it doesn't cause you pain. But the bacteria is still there, and it's just going to get rotten underneath. So it's always good to go for a checkup.
Absolutely. And just thinking about what you were saying, there are a lot of people you'll notice who are elder people. They're sitting and they're eating in a restaurant, and they're eating something and their teeth come out. It's very, very embarrassing. And, people might, they hold their hand over their mouth. But, and then they don't want to go out anymore. They don't want to eat out because they don't know if their food's going to, if it's going to come out or not. And so I would think that anybody who's having these kinds of problems, they don't have to have. See, a lot of people years ago, they didn't have dentures that were like you were talking about. That was what they had to have. And, they were just careful. They just ate more, mushy food rather than having, a nice piece of meat or corn or something. And now they can be assured of that.
And also what I want to address too is the process, they have been more affordable than they used to be 5 or 10 years before. Implants, they were for a few, not for everybody. Now we can see most of the patients, they start seeing the advantage of implants and they start getting them more and more. One of the things I say, like $1 million smile, doesn't have to cost you $1 million. Pretty much that's the way it is.
That's a good thing to say. So tell us about being a prosthodontist. You went for a lot of extra years to become a prosthodontist.
Yeah, prosthodontist is a really wonderful specialty. I like it because we study in depth for 3 more years. After you finish dental school, you have to go 3 years again, full time. On those 3 years, you have to learn about how the patients do mastication, the occlusion, materials you're going to use, or how going to restore a full mouth. If you have a patient with cancer and parts of the mouth that they have been removed, how you're going to restore that part. So we involve everything. We do from a simple filling to restore a whole mouth. And we have to go for those 3 years of practice and 3 years of studying and to always keep up to date with that. So I think that's what it makes a difference. In Florida, I don't see most of the people there familiar with a prosthodontist. It's pretty much you see people in Chicago, Boston, they know. But here, you might hear, the endodontist, I know, the root canal guy, the periodontist, some of them they know, the gum specialist. The orthodontist, when I say, I'm a prosthodontist, they ask me, do you do braces? No, I don't do braces. But, it happens. It's just about, that's what it's important for people to know the difference. And we know that many prosthodontists here in Florida.
And why is that? They don't want to spend the extra 3 years? Don't they see the importance?
It's
Well, let me ask you another question.
Also.
Why was your father a prosthodontist or a dentist? I mean, what made you do that?
Actually, my family, most of them were physicians.
Figures.
Yeah, so I tried the path of dentistry. I love dentistry. And when I finished as a general dentist, I started going to these courses. And there was like a weekend course, to do this rehabilitation or to do this. But they were trying to sell me a product. And I said, that's not what I want. I want to do something that's going to last. Something's going to do it once and do it well. And then that specialty answered all my questions. You have to go 3 years full time. Again, you want to do that? Okay. So I went for that.
Yes.
But that's why we're not that many, I think.
It's very, very important that people realize that. I'm glad you shared that with people because, as you said, sometimes it seems like it's their teeth and maybe it's not and maybe more. But you've studied enough of their cavity, the oral cavity, that you can figure out. Have you ever come across a case that was just impossible? You didn't know what to do? I mean, was there anything ever like that? Or what was the most difficult one? Let's talk about that.
Most difficult one, I can mention some, but I had a patient, we had to rebuild part of her mouth because she lost most of her teeth in a car accident. Mm-hmm. And part of her mouth was burned. So she couldn't open properly for us to work and do the impression. So it was really tough. But we were able to go with the procedures. Actually, general dentists, when they see a case, they can see, I don't see what kind of material I'm going to place on this patient. I don't know what kind of things I'm going to do a bridge. Is this a patient candidate for implants? What can I do? So some of those general dentists, they refer to us. The complicated cases also we manage to.
Complicated cases like you just shared. Someone they were so badly burned they could hardly open their mouth, but he must have a lot of patience. I don't
Exactly.
mean patients, but patience with someone.
Oh, she was wonderful. Patient cooperated, beautiful. So
And
we
she's
put our effort.
okay today.
Absolutely.
Oh, now that's a wonderful thing. So that's what I was asking for. Were there such difficult cases so people do refer, other dentists would refer if they just can't figure out what to do?
Yeah, there's some general dentists, they still have how can I say? They still have the values.
Yes.
They say,
Integrity.
we all know.
Integrity.
Exactly. We all know our limitations. So I say, this case is too complicated for me. I'm going to refer to a prosthodontist. Instead of doing the work and after that send it to me. See? Because patients get frustrated, like, oh, doctor, but I just spent this amount of money 6 months ago and now everything has to be redone. See? So that's the difference. With this dentist, they say, you know what, I'm going to stop here. I'm going to send you to the specialist. Like some of them, they say, I'm going to send you to the endodontist. I'm going to send you to the periodontist. It's because they care about the patient. They say, this is my limitation is up to this point. I'm going to put you in hands of the professional. And that's something really important.
It is. So there will be other dentists, hopefully, will see you, because I think it says prosthodontist in your advertising, which is really good because you need to,
And also we have a specialist on our practice. We have an endodontist going to our office, and we also have a periodontist. We are a team.
So you have for children. People can bring their children there.
No, periodontist.
Oh,
the gum specialist.
periodontist. I'm sorry. I thought you said pediodontist.
Yeah, periodontist and the endodontist. We have them at the office.
Right.
And I like it because we get together, 3 of us, and we share. Okay, I have this case. We show the x-rays. Oh, we're going to go this way. We're going to work out together to do this kind of treatment. And this is not, you don't have that handy everywhere. Because most of the places, the dentists, they do everything. And here you have 3 doctors discussing your case.
You're absolutely right. And there are many people that have to have root canal, and you call that the endodontist?
Endodontist, correct.
And
you're learning quick.
Oh, well, as a matter of fact, I'll tell you an interesting story. But I had gone to a dentist, and he just couldn't do anything else. And he said, oh, we're going to have to pull your tooth. And I didn't want the tooth pulled. And I had a cousin who was a dentist in Miami. I was telling him, he said, forget it. You don't have to. I have a friend who does endodontistry, and he's the best here in Miami. Mm-hmm. Well, sure enough, I went down there, and that's all he did. And he took care of it. And when I came to tell my dentist, who's really a very nice man, he said, give me his name, because I would rather send patients to someone like that rather than have to pull their tooth. So that's called integrity also, but he just didn't have the knowledge. So it's what you've been saying, that you have a team now that whatever the particular case is, you want it to be the best, because in the long run, that's how you're going to keep your patients and get new patients.
I want my patients to be happy with the work, and I want the patients to last longer. If I put you in hands of the specialist and you don't have to go to any other office because they're there. We set up an appointment.
So you have them right there in your office. Yeah. You bring them in.
Yeah, they have certain days and they go. So I don't have to tell the patient you have to go here and here and here. They go and they have all the service there.
I had to go down to Miami. That's a great idea.
Yeah.
So you have that. So, and you know enough, of course, being an endodontist, of what can be and what isn't going to be possible.
Yeah, the endodontist will let you know if sometimes I can say, well, no. Me as a prosthodontist, I can give you a general idea. If I say, oh, we can save this tooth, but we have to do a root canal. So my endodontist, my specialist, is the one who's going to do it. And then you're going to come back to me so I can do the crown. So if you get anything, you're going to get from the best. You need gum surgery, any gum treatment, the periodontist is going to take care of you. And then we're going to take care of putting the teeth together.
Years ago, I had gone to a periodontist because my family has history of gum disease. And so I'm very careful with my teeth. And went to a periodontist, and he really did take care of it. And he said, if you floss your teeth every single day, I'll never see you again. And is that what you tell your patients?
But you also have to analyze this. Before, we didn't have to have too much care on the dental care, let's put it that way. But as you can see now, the diet we have these days, we have people drinking these soda drinks and sugary, and also they go for a cocktail, just plenty of sugar and mix here and here. So our diet has been changing a lot. If I'm telling you 20 or 30 years ago, oh, let's grab some oranges and we're going to do some juice. So that you might cut the orange and chew on it, right?
I always did.
Now, no. Now, if I'm going to give you some oranges, you're going to say, you're crazy. Why you don't give me the orange juice, So those things have been changing. Or diet diet habits, they have been changing too. So that is going to put us more prone to decay and everything what's happening now. We have also patients, we go to radiotherapy. So the quality of the saliva diminish, and patients who never have decay or never had too many work done, all of a sudden they have to have everything because decay just go rampant in the whole mouth. So we have to face the challenge. You know some people who had cancer, even in your family or friends, me on my part as well. So you see how things are changing compared to before. Our diet has been completely different.
And of course, and people died early.
Yeah.
And so you didn't have these problems. But now I'm sure you have patients who are 80, and do you have patients in their 90s?
Yeah. Yes, I do.
It's a wonderful thing.
Mm-hmm.
I had an orthopedic surgeon on my show, and I said to him, would you operate on a person who is 95? He said, I just operated a person 103. I said, really? She was in great health, and we did it. So it's a changing world, isn't it?
It is.
It brings a smile to your face.
Yes, it is.
So you're happy. It sounds like I like you because you sound like you're a happy dentist. I can call you a dentist. Do I have to always call you a prosthodontist?
No, dentist is fine.
But you're happy, and I know that you're doing a good job. So let me give your phone number again, and hopefully people will call you. 561-749-9721. 561-749-9721. And this is Dr. Alex, correct? Alex.
Yeah, Alex Morales.
Alex Morales. Dr. Alex Morales, and he is a prosthodontist, and he's in Delray Beach. Thank you very much.
Thank you for having me.